Good morning, Tamika. We've been together for the past 2 days. How did you sleep last night? You slept well? Okay, perfect. I'm happy to hear that. Did get orders from the doctor. You will be discharging today, like they discussed. And you have a few new medications, and then you have your two medications that you will resume. And I want to go over those medications, just kind of inform you of some expected outcomes, what the medicine does, things to report to the doctor. So you have two new ones for your blood pressure, one being Lopressor, which is metoprolol, 50 milligrams a day. And I'll give you this once we go over everything. You'll have this packet. This is yours to keep, or I'll get you to sign it, and I'll give you your copy. With the Lopressor, it lowers your blood pressure, so that way it decreases the workload on the heart. It also slows the heart rate, but we have to be careful. Before taking it, we do need to check the heart rate, because anything less than 60, we shouldn't take it. We want to hold the medication. And you also want to report to the doctor that you're having low heart rates when taking the medications. Are there any side effects? Yes, there are side effects. Dizziness, that slow heart rate, depression. You may see some depression or maybe not, but those are some things to watch out for. Feeling tired. If you find yourself feeling tired, this can definitely be one of the side effects to the medication. You don't want to stop it suddenly. If you find that you are experiencing some of these side effects or some of the adverse effects that we need to report to the doctor, you want to make sure you don't stop the medicine on your own. Call the doctor right away if you have swelling in your legs, or you have some shortness of breath, and or you fainted with taking the medications. And of course, like I said, with the heart rate being less than 60, we definitely want to notify the doctor right away. Sorry about that. Yes, you want it. It's once a day that you're taking it by mouth. Yes, the second one is lisinopril, 10 milligrams daily. It lowers the blood pressure. So you will be taking two medications that lower your blood pressures. It improves the heart function, and it protects the kidney. Yes, there are side effects: dry cough, dizziness, high potassium, and low blood pressure. Yes, low blood pressure is a side effect, but that's also the expected outcome of the medicines. But if the blood pressure is too low, 90 over 50, systolic being 90, diastolic being 50, so that's the top number being 90 or less than 90, and the bottom number being less than 50, we definitely want to report that to the doctor. So you want to be checking your blood pressures. You want to monitor it. You want to stay hydrated. That's something that with this medication, you want to make sure you're staying hydrated. Call the doctor if the cough is persistent, won't go away. That's something the doctor needs to know. If you get any swelling of your face, lips, tongue, call the doctor. Muscle weakness, call the doctor. Severe dizziness, call the doctor. Those are things that we need to report to the doctor right away, and he needs to know if these things happen while taking the medication. Okay, so your third medication is metformin, and this is the medication for your diabetes mellitus. It lowers the blood sugar, which is exactly what we want it to do. And then it improves insulin sensitivity, where the insulin can get into those cells. Yes, there are side effects: diarrhea, nausea, metallic taste in your mouth. Yes, unfortunately, you may have some diarrhea from this medication. Okay. You want to take it with meals. Don't drink while taking this medication. Uh, mhm. And if you have to go and have a procedure and it's with contrast dye, you want to let them know that, because this medication should be held if you are having a procedure that requires contrast dye. Okay. Well, you want to report some things to the doctor as signs of lactic acidosis, and that would be fatigue, muscle pain, any breathing issues, abnormal blood sugar. You want to let the doctor know these things right away, which is why it is so important. I can't stress it enough to make sure you are logging your blood sugar readings, your blood pressure readings, your because you want to let the doctor know these numbers, and if these numbers are too low or too high, you want to let the doctor know that. Okay, okay. You have any questions? No. Okay. Well, we now can talk about, you've been taking these meds before you came to the hospital, and it's Synthroid, 100 micrograms daily, and that is for your thyroids. Your so you were probably already taking them first thing in the morning before breakfast, and you want to try to drink a full glass of water when you're taking them, and same time every day. Yes, yes, with the Synthroid. Okay. Yeah, and then you want to, if you consistently find that you're having a fast heart rate when you take the medicine, and it is a medicine that you will be taking first thing alone, so you will be able to determine if your a fast heart rate, is happening when you take the medicine. You want to report that to the doctor. If you're having trouble sleeping, if you're having chest pain, call and notify your doctor. If it's an emergency, call 911. Okay, so you are familiar with the medicine, Synthroid. Okay. Well, Protonics, I just want to let you know that he's also ordering you to resume that medication, and it reduces stomach acid. Oh, you've been taking it. Okay. Well, it helps prevent GERD and heartburn. You want to take it before meals, preferably before breakfast. But you can decide how you want to do that, being that you have this Synthroid that you take before breakfast early morning, or just take it before your meals. Don't crush it. You want to swallow this medication whole. And as before, the same thing, you want to report severe diarrhea, any blood in your stool. You do. Any abdominal pain. Yes. Okay. Okay. You have knowledge of those meds. Okay. Well, that wraps it up as far as the new orders that the doctor prescribed, and the ones that the doctor wants you to resume that you were taking prior to your hospital stay. And I just want to make sure you feel comfortable with the new medications. Everything that we talked about and went over is in this package. So I'm going to get you to sign that we talked about the new medications. We talked about your previous medications, and that you understand about each medication, and you're comfortable with going home with the new medications. Okay. Do you have any questions? Okay. Okay, no problem. When will you get the medications? Well, they're discharge medications, so they'll be sent to your pharmacy that you normally use, and then y'all can get those picked up. Do you need more of your medications you were taking prior to this day? Okay, well, we'll talk to the doctor, and we'll get an order for those also. So they'll be sent to your local pharmacy, or your pharmacy of choice. Sorry about that. Okay. Not really sure of the time that you will be going home. It is today, once we get everything ordered and make sure that everything lines up with the doctor's instructions and the doctor's order. It was a pleasure taking care of you. Alrighty, thank you. Alrighty, well, I'll go ahead and finish wrapping up everything for your discharge. If you need me, you know how to reach me, press your call light, and I will be here.